we've asked in us, what is it that would make a difference to stop this epidemic in a home? And the movement of staff is an absolutely critical one, and how the virus actually moves within a home. And that has really only begun to become evident since we've been able to look at new techniques like genomics. And that has given us a huge insight into the dynamics of what is happening within a home. And not every home will be the same in the way that, you know, people, residents and the staff interact, the use of bank staff. But there is some very interesting learning that we've come across quite recently. Now, whether testing would have made a huge difference or not is impossible to say at the moment, and that's one thing we'll want to learn. But there has been testing, but I think there are possibly more fundamental and structural issues about how care homes are run in an epidemic that we are now looking to implement.
Thanks, Dan. Matt Foster from Politics Home.
Hi, First Secretary of State. Your colleagues have spoken about us all being in this together, but there are a sizable number of people in the UK who, despite paying taxes, are barred from claiming universal credit, housing benefit or free school meals for their kids because the Home Office deem that they have no recourse to public funds. Some of those people are working in key frontline jobs right now in the NHS, social care and as delivery drivers. Will the government consider at least temporarily pausing NRPF status during the outbreak? And if not, what reassurance can you give people that they're not going to be shut out of the same help we all may need to rely on during an economic crisis?
Look, I absolutely understand the point, and obviously we feel for anyone who's going through the challenges, whether professionally or in their home. I know the Home Secretary has been looking at this very carefully. She keeps these issues under constant review. I think she's been before the Home Affairs Committee today and said that we'll always look at new measures and what more can be done, particularly in relation, I think, to frontline workers from overseas who are working either in care homes or the NHS. So I can't give a commitment, but I can tell you that the Home Secretary is very carefully looking at that, and the government wants to make sure we're as sensitive and as flexible in our approach as we possibly can be. Do you want to come back with another one there, Matt?
That's fine, thanks.
Very good. And then finally, Peter Madley from the Express and Star.
Thank you, Secretary of State. Question for the medical experts. Schools across the West Midlands are starting to consider how things might look once they're up and running again. The Education Secretary said today that schools will reopen in phases and clearly some form of social distancing will be required. Can you give us an idea of how you think social distancing will work in a school setting, and do you envisage home education continuing for some pupils into next year? Secondly, a question for you, Secretary of State. You mentioned repatriation flights before. There's still thousands of British citizens stranded in India, particularly in the Punjab region, a lot from West Midlands in that area of the country, in fact. The CTM charter team has said this week that more than 20,000 people have registered for flights, but from an Amritsar in the north, there's only one flight every couple of days with a maximum capacity of 300. So people who are running out of money and medicine are being told it's not possible to confirm when they'll be able to get back. Now, do you have an idea of how many Brits are stuck in India, and are you planning to increase the number of repatriation flights from northern cities so these people can return home?
Well, thanks very much. And look, can I first of all say the incredible effort from the West Midlands, where you're reporting both the NHS, care homes, and frankly the people following the social distancing guidance has made a massive difference. We follow the regional impact of all the measures that we're putting in place at an NHS capacity, and I know the West Midlands have put in an incredible shift. On repatriation flights, and just to give you a sense, we've already chartered, so separate from the commercial flights, 58 returning more than 12,000 people from across South Asia. I can tell you that in recent days we've announced 28 more charter flights with the capacity to get around 77,000 more Brits back home. They'll return home. That scheduling would be up until about May the 7th. They include 14 flights from India, another 9 from Pakistan and 5 from Bangladesh. So we're doing everything we can to get stranded Brits from the West Midlands and right across the country home. And as I've said that in my earlier remarks, I think the Foreign Office and the Department for Transport and our missions abroad put in a heroic shift. But look, the job's not yet done, and as long as there are people that are in a predicament, we want to see what more we can do. I don't know whether Jonathan or Yvonne want to come back. Schools, on schools, yes, please, Jonathan.
Yeah. So I've got two sons, Alex and Theo, at home, 11 and 12, and I know exactly how difficult it is for them wanting to go to school, and the stress and strain that this is placing on people. But I'm absolutely clear that it was the right thing to do to close schools when we did. And equally, we now have to be very careful indeed about how we relax social distancing measures and when we do it. And clearly there are multiple combinations of how one might think about that. I'm not going to go into those in detail because the scientific thinking is not yet complete or settled on those. It is still a matter of detailed daily deliberation and study. And clearly, as part of that, relaxing schools is in the mix. Precisely how one would do that, I'm not going to comment further because I think there are multiple permutations that you can think of, and we have to work through those carefully, one by one, scientifically, and get the best and the most optimised answer we can. So I wouldn't want to make any premature comments about exactly how and to what extent schools are going to be involved in how we relax social distancing carefully, painstakingly, and as and when we can with safety.
Peter, is there anything else you'd like to come back on?
Yes, Mr. Van Tam, if I can be a bit more direct with my question in that case, do you think it's possible for groups of young people to stay 2 metres apart all day long in a school?
I think that would be very difficult with a classroom of 4-year-olds, 5-year-olds. I think that would be really tricky. I think we have to think through all of those measures and how that might work.
Thanks very much, Peter. I think we've now got a couple of questions from members of the public. We've got Matthew from Surrey who's asking what is being done to ensure that visitors or returning citizens coming through British ports and airports are going into a 14-day quarantine, and why hasn't this been implemented before? I'll turn to Yvonne to answer this, but we've looked at this regularly. I've asked this question actually quite a few times, and so far the advice has come back that actually it wouldn't make any significant material difference to stopping the spread. It may become more relevant as we progress through this crisis and as we bear down on the transmission rate within the UK. But Yvonne, I don't know if there's anything you'd add.
Secretary of State, not very much. So Matthew, thank you. It's a really interesting question, and obviously as we move into a new phase over the coming months, it's one that will come back again, and the Scientific Advisory Committee is looking at all of the measures that ports could and should perhaps do implement that would make a difference. That's the important thing, because otherwise we're just disrupting everything for no particular gain. And we have had some experience of it, of course, during the contain phase, when we worked intensively with all the ports in Britain to ensure that we kept our citizens as safe as possible. And we've learned quite a bit from that. But there are a number of measures, of which quarantine is one, and it is being looked at.
And of course, as we keep the ports and the airports open for vital supply chains, that's a consideration as well. But we'll continue to keep that under review. I think there's a second question, which is coming up on the screen.
As there has been success so far in not overwhelming the NHS, and there seems to be plenty of space in the Nightingale hospitals, why can't we remove some residents from care homes for their immediate safety? If this takes place immediately, and perhaps with military assistance, this could save some lives. Is it feasible in any way?
Well, I'll let Yvonne talk to the current situation. What I can say, it's something that has been under constant discussion. Of course, we want to make sure, and the Nightingales have been amazing, and the military done a great job in supporting the NHS teams. We've got to make sure we've got the NHS capacities as we set out in our 5 principles for how we might move forward to the next phase, that it's not just there to deal with the current cases, but to deal with the future demands that may be put on the NHS, both in relation to the virus, but also other health needs. But we're looking at that, not least in the context of some of the cohorting that may need to be done, which hasn't been done in some areas it has. So it's certainly something that, again, remains under review. Yvonne, do you want to say a little bit more on that?
Thank you, Secretary of State, and thank you, Bob. Yes, so it is. And the Nightingale hospitals, they operate on a number of different models, and we're looking at the difference between those models and whether they are adaptable to circumstances that may arise as we go forward, of which this would be one. And the issue about the home residence is that this has to be a humane solution for people, that it isn't more damaging or harmful to have people move, particularly people who are already frail, vulnerable, maybe suffer from dementia. So it has to be looked at as a judgment in terms of what is the best thing to do for those people and what is the most humane intervention given the risk they may face. But it is certainly, it is something that is looked at and will be continued.
It's worth also just saying, Bob, that one of the pieces of learning that the Cabinet Office had from 2016 when we looked at the lessons learned from the flu epidemic we had was that the shift of people out of the NHS and into the community, including care homes, was something that was important and which should be taken forward. But I understand your question. We've got to make sure all of these things are done safely, and that doesn't mean that certain NHS facilities couldn't be used in the way that you've described. So we're looking at all of that. Thank you very much, Bob. Thanks, everyone, for all of your questions. And that brings to a close today's Downing Street press conference. Thank you very much.